What if your compliance executive could save your organization from catastrophic failure, but you've positioned them as just another department head instead of your trusted partner? In this episode, Ross breaks down the 2008 film Margin Call to reveal exactly what happens when compliance teams have the data, the expertise, and the warning signs, but lack the authority and positioning to prevent disaster. Ross introduces his steady framework, showing you how to transform your compliance executive from a regulatory cop into a compass who enables growth and protects everything you've built. You'll discover why 89% of healthcare fraud cases involve leadership who knew about compliance concerns but failed to act. You'll also learn 5 essential qualities that separate true compliance partners from checkbox officers. This isn't about avoiding problems. It's about building the competitive advantage that lets you grow with confidence.
Welcome to the Compliance Advantage podcast. This is where healthcare executives transform compliance from a burden into a strategic asset that drives both growth and peace of mind. I'm your host, Ross Ronan, founder of Ronan Healthcare Compliance and a healthcare compliance strategist with nearly 30 years of industry experience. I'll help you stay ahead of evolving regulations while building the sustainable, compliant organization that lets you focus on high-level strategy and exceptional patient outcomes. Remember, compliance pays dividends. Invest today.
Ross, you've talked about compliance as a strategic partner before, but I want to dig into what that actually looks like when it goes wrong. There's this movie, Margin Call, that you reference sometimes. For people who haven't seen it, can you set the scene?
Yeah, I know. I love this movie. I've watched it 100 times, probably exaggerating a little bit. But when I watched this movie at first, it just kind of took me back to the housing crash of 2008 and all the investment banks who had all these loans that were underperforming. And when I started thinking about it as it relates to compliance and healthcare and compliance programs, it really resonated with me about having a strategic partner, or what we call a steady partner. This 24-hour period before, it's fictional, so it's not a specific investment bank, but it's about a 24-hour period that before the housing crisis fell, or the mortgage collapse in 2008. There's 3 main kind of characters here. It's Stanley Tucci's character, Demi Moore's character, and then Kevin Spacey's character. Now, Stanley Tucci was essentially, we'll call him the risk manager, compliance officer of the organization type person, right? And his boss was a chief risk officer. It's Demi Moore, who was kind of more like an operations person who really kind of looked out for operational pieces of it. And then Kevin Spacey's character, who I don't know exactly what his title was, but he was responsible for all the traders and all the mortgage selling the mortgage, essentially stocks that they had. And the most interesting part before this is they had all the data showing that the housing market, these mortgages were going to fail, and they just hadn't finished it. So Stanley Tucci's character, Dale, who was the risk manager type person, was working on all this stuff, but just didn't finish it, just didn't have it communicated, just didn't tell anybody about it. And sometimes they raised concerns, and they raised a little bit of concerns, but they really didn't have any data or were able to be in a position to have that conversation as a strategic partner with the leadership of that investment bank to go, hey, you know what? We need to start way in advance and start rectifying the situation before it becomes a complete and total disaster. If you look at that in healthcare, the housing collapse was essentially like what the DOJ and the OIG has been recovering over the last, 30 years-ish, 30 to 40 years. $70 billion they have recovered in False Claims Act violations and things like, there's a lot to learn here where we can sit and see what are the violations, what are the penalties that are happening within the country as it relates to healthcare, similar to kind of the collapse of the housing market where there's a bunch of investment bankers who went out of business and a lot of people lost their homes that they couldn't really afford it. And it really was devastating for the economy. And I think healthcare fraud and compliance programs can help prevent a collapse like that, a collapse in the healthcare system, by ensuring that we do have a steady partner as a compliance officer and who is very strategic.
So, what went wrong? They had the expertise, they had the positions.
They did. They had the expertise, they had the positions, and what they didn't have was an individual who was responsible enough to finish the analysis, finish the work that was done, to be able to come to a conclusion and make a recommendation to the leadership and have the leadership give them enough clout and responsibility and respect to listen to them and make change. I do feel like that there was some communication going on from Stanley Tucci's character to his boss, Demi Moore, but it didn't have factual data, didn't have any information on it. It was circumstantial at best, and they didn't really know what to do with that. Or if they did, they weren't really forceful enough to make a change. And I think that's really what went wrong. It was this lack of urgency, lack of communication, lack of trust and strategic thinking that really led to this investment bank. And again, it's fictional, but I do believe that it is very indicative of what happened with these investment banks at that time.
Walk me through how this connects to what you call the STEADY framework.
Yeah, the steady framework is really the steady partner that I'm talking about, which is that compliance executive who can actually do the necessary things that need to be done. And steady is an acronym that we love acronyms in healthcare. Everything is an acronym of some sort. So steady stands for being strategic, transparent, able to evaluate situations, is adaptable to situations, documents and communicates things efficiently, and ultimately understands the yield or the benefit of the compliance program and is able to produce those pieces. In margin call, if you look at it, every one of those aspects, and I think we'll talk about them a little bit, there's some aspect of it that breaks down. And there's some aspect of it where if you would have had the steady partner, things might have gone differently to be able to circumvent this crash. We see this in healthcare. If you don't have the right people, if you don't have the right strategic partner, you don't have that right compliance executive who is that steady partner, you are running the risk of not knowing what you don't know and ultimately being held with some sort of big fine, penalty, or a big surprise that you never knew was coming.
Okay, let's start with strategy. When a healthcare CEO is considering expanding to new locations or adding service lines, how does Stanley Tucci's character's situation relate to that kind of strategic decision making?
When you think about the movie and the person who is identifying the issues, Stanley Tucci's job, call him the compliance officer, even though I don't think that's what his title was. I don't believe he was involved in the strategic thinking of the organization of the investment bank to be able to sit down at the table and go, this is our objective here. These are the things we're going to invest in. And these are the things that we want to continue to do. If your compliance officer, your risk officer is sitting there and saying, whoa, you understand that you're combining all these B and C mortgage packages with A's and B's, and you're creating these bundles that will eventually fail because some people will miss their mortgages. The whole thing collapses around itself. They could be part of that decision to go, let's not do it this way. Let's make sure that we are mitigating our risks here from that standpoint. When we talk about strategy, there's a lot of strategy when it comes to a compliance executive to be able to provide that information to the CEO, to any other healthcare leader in the organization who talks about expanding into a new state or talks about, I want to add another service line. There's risks to doing all of those things. And if you go out and just make a decision to do it and on the back end say, hey, compliance or risk will figure it out at the end of the day and tell me if we're okay, again, it can lead to devastating consequences, just like in margin call. If they thought up front, maybe they wouldn't have sold everything. Maybe the housing market wouldn't have bust. They would have been able to prevent these things from happening. And the same thing in healthcare. If you're going to go out and get a new location, you're going to go out and get a new service line, You got to know how to bill it. You got to know what the state regulations are. You got to know what you're doing to ensure that you can function compliantly in that location and in that specialty. And really having the compliance person be part of that strategy and strategic partner is number one.
What about transparency? Healthcare organizations often have multiple layers where information gets filtered. How does this movie show what happens when compliance teams can't speak directly about serious risks?
Yeah, we do talk about this a little bit on a lot of different areas and compliance executives, like who do you report to? What information do you report up? And I often say if you have a go between the compliance officer and, say, the CEO and the board, a lot of that message gets watered down. The message doesn't come from the person who knows the risks. The message then comes from somebody in between who can make it sound like it's less harmful than it is, or it's truly watered down. Now, if you have the right steady partner in a compliance arena, they'll be telling you the clear, concise, and correct things that need to be communicated. They're not running around throwing red flags everywhere and saying everything is a problem. They're saying, you know what, these are the one big issues that are out there. So we talk about transparency in this movie. Stanley Tucci's character almost had all the information that they needed. He was not transparent with his own team to be able to pull everybody together to say, hey, let's figure this problem out. He kind of kept it to himself and not communicating, keeping things close to your chest as a compliance person or a compliance officer does not a teammate. And that's what happened here. It took him getting fired. He got let go, which is another issue in and of itself, letting go your chief risk person or your risk manager or your compliance officer. And then ultimately ended up giving his information to an analyst, somebody who worked for him, on the way out. So he clearly wasn't transparent with the information that he had and really is hiding the hard truth and doesn't build that culture where it says, hey, let's communicate things appropriately. Now, I do believe that there is some circumstances where they did communicate it up, but you also have to make sure that it's being listened to. No, I think there's a report here that says 89 by the OIG, 89% of healthcare fraud cases involved a leadership who was aware of the compliance concerns but failed to deal with it. So transparency is not only just letting people know about it, it's also creating action and mitigation efforts. In healthcare, if you identify a billing issue as a compliance executive and as a steady partner, it's not only knowing that it exists and that you have to fix what's going on. I've had a lot of people or executive teams come up to me and go, well, that's fine. We fixed it. And I have to go, okay, well, there's a requirement that we go back and fix what we've done in the past and make sure that we correct it. And so being transparent about what it is that we do is a whole nother story that we need to be able to communicate what the requirements are and what is needed to be done to reduce risk.
Let's talk about evaluation. Many healthcare organizations do compliance audits and risk assessments, but it sounds like having the data isn't enough. What went wrong with their evaluation systems?
And it's really important to ensure that information is not just captured, but it's understood and analyzed. We see this a lot in compliance as it relates to auditing and monitoring. Sometimes we'll get a billing and coding audit that's out there, and we take for face value what the auditors give us, right? Here it is. Here's your results. Here you go. And I've seen a lot of compliance people do this because they say, well, I'm not an auditor. I'm not a coder. I'm not really a person who understands this. And that's the last thing that a compliance executive, at least the steady partner, should do, right? Because the evaluation side of it says, hey, sit down, take a look at this audit, take a look at this situation, and then see what it really truly means as it affects the organization. Does it have risk factors to it? Does it require a refund? Does it require a look back? Is this just something that is a best practice, or is this something that is a have to, right? Is it a should, or is it a must? And how do you make that without the evaluation pieces of it? And so we see that a lot. And, a lot with the anti-kickback statute too, if you start having your steady partner, who's a good steady partner, look at it, they will evaluate an anti-kickback statute. They'll do an anti-kickback statute analysis on a potential kickback issue. With every single one of them is different. And so you have to evaluate every single one of them like it's the first time you've ever seen it. And you have to go through the step-by-step process. You can't just say, it's an AKS violation. Here you go. Here you go. Right? And I think the same thing happened in Margin Call, where Stanley Tucci's character was putting all of this information. They had everything that they needed to show that there was collapse in the housing market and the people were going to start defaulting on their loans. And he just couldn't finish it, right? He didn't finish the evaluation. And as soon as he did, as soon as he left, but as soon as his analyst did, things started moving, right? And all of a sudden, the evaluation made sense, and you started looking at how that affected the organization going forward, and they acted really quickly on that standpoint. The steady partner must be trusted to communicate and deliver that uncomfortable information and be able to make change.
When that crisis hit, what happened with their ability to adapt? Healthcare organizations sometimes discover they're facing a potential government investigation or audit. How should compliance teams be positioned to help leadership respond quickly?
Adapting to situations as a compliance executive and a compliance program is really important to be able to start understanding what the business is and how these compliance issues really do affect the business. So if you don't really understand your business as a compliance executive, you need to stop. You need to take some time. You need to figure it out. You need to talk to your CEO and your COO and figure out what you're doing. As a CEO, when you're looking at your compliance executive, they need to be able to adapt to the situations. And that's what the steady partner can do. Whether you're adding a new location or you're adding a specialty, or you want to do a compensation package that's a little bit different, that steady partner should be able to adapt their thinking, their processes, as long as it's within the regulations and the laws, to whatever you want it to do. In this movie, the first thing they did after they figured out that they had this huge issue by this analyst finishing Stanley Tucci's work was go to find Stanley Tucci, and because they had let him go, right? So the first thing they're doing is, we're going to get the guy who figured this out back. They couldn't figure it out. They couldn't find him. And then they started really having meetings to mitigate the issues. And what the first thing that they did was had finished the analysis, finished the information so that they can figure out what to do. And I think that was the ultimate level of adaptation, right? They adapted to the situation. They adapted just 24 hours before the collapse, right? They sold all of their stocks out to other people, knowing what they knew, and nobody else knew it. So they adapted to this. Now, it's a crappy thing to do. It's not very ethical, but they adapted to the situation and really took after it. And I think when you think about it in a healthcare standpoint, especially like a billing issue, and I do relate a lot of things to billing and coding issues because False Claims Act is the number one enforced action, and where the government gets a lot of their money and their recoupments from is False Claims Act violations. So if there's a healthcare compliance executive who is a steady partner, who identifies a billing issue, they need to be able to adapt to the situation to say what happens next, right? So prevention, detection, mitigation is really important to be able to do. And that individual should be able to say, look, we're going to stop billing. We're going to figure out what we're doing wrong here. We're going to do some education so it doesn't happen again. And then we're going to mitigate what's happened in the past and refund the dollars that are out there. So from an adaptation standpoint, we have to be able to kind of adapt our thinking to how we're going to situationally deal with matters, just like they did in Margin.
This episode of the Compliance Advantage podcast is brought to you by Ronan Healthcare Compliance. At Ronan Healthcare Compliance, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards. We elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Compliance is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Compliance, redefining compliance, empowering leadership. Visit us at ronanhc.com to learn more. Now, back to the show. There's something really interesting about what happened when Stanley Tucci's character was let go. For healthcare organizations, turnover in compliance roles can be really disruptive. What does this movie show us about building systems that don't depend on individual people?
I think this is probably one of the most telling parts to this show, where he's being let go. He is working on a project who, again, transparency, didn't tell anybody what was going on. And clearly didn't have it documented where anybody else could see it. Anybody else could find it, right? On his way out, he gives this thumb drive or USB drive to the analyst and said, you should check this out. The first time somebody has made a communication of documentation within that movie of something really important. And I look at people in compliance, and I look at people who are compliance executives, and that steady partner as a CEO and as a board member. And I'm sitting here looking at, who do I want to run my compliance program? Who do I want to, who do I want to be responsible for what we do here? I want that person. I want that steady partner. That steady partner is going to keep clear and accurate documentation of all the steps that they've done so that somebody else can pick it up when they go, or they're sick for a day or get let go. Somebody else can find what you're doing. There's so many times that, and this happens not just in compliance, but it happens in leadership. It happens anywhere in the executive teams. The more they feel like they do and the more that they hold to their chest, the more important that they feel. Like, if I'm the only one that knows this information, then I'm really important, right? You don't know where to find things, you need. You don't know how to do this, you need me. You don't know kind of how to solve this problem, you need me. And therefore, I am invincible and I am indispensable. That is the single worst attitude that you could possibly have. It's not about what you know. It's about what you do with it and how you communicate it, in my opinion, right? And how you're open. If somebody else can do your job better, then they should be able to do that. Don't ever let anybody do your job better. That's my key. But it's not about how much you've held to your chest. And this is what documentation is really about. Just because you're a compliance executive, your leadership as a CEO, you need to ensure that your compliance executives are documenting, communicating, have process flows down, understanding how to do things, SOPs, SOWs, making sure that everybody can step in any situation to do that. And that compliance executive then becomes, their value becomes an executive to you, not necessarily just a holder of knowledge and information, right? That's what the documentation's about. How do we get documentation? How do we keep that steady partner documentation information flowing to the right people? Because again, it's not about how much, it's about how you do it. And that's really important. That's what the CEO should be looking for in their steady partner.
When you look at the yield aspect, the return on investment, what should healthcare leaders expect from treating compliance as a strategic partner versus just a department that handles regulatory requirements?
You know, yield is always a fun one in our acronym because it could mean two different things, right? Yield, or what is the yield on what I do? And we chose what is the yield on what I do? It's really hard, and you'll hear this all the time from CEOs. What's my ROI on a compliance program? And we've actually defined it pretty well from that standpoint. We know that there's an ROI for a lot of different reasons. It can help identify profitabilities through kind of regulatory changes and pathways. It can prevent costly violations that would be out there. It can also build like payer, patients, other providers trust so that you can be reputable and you can be profitable when it comes to what you're trying to do. Patient trust equity is a huge thing for one of our kind of core values, is making sure, A, do no harm, B, treat patients the way that you want to be treated and make sure that they're getting great care but also you're building that trust equity in them. And as a yield, that is a huge ROI when it comes down to it, right? And when we look at kind of the movie, they had the yield for their risk department really was the fact that they did find the information. They did do the analysis. They did pinpoint the issue, even though it was late, right? There was a yield to what happened with having that program in place because there was a lot of investment banks at the end of the day who didn't take action prior to the collapse of the housing market in 2008. So the fact that they had this program in place mitigated their yield, right? So instead of they took a big haircut on all their stocks, they lost, I don't know, millions or billions, whatever. No matter what, they lost a lot of money. But you know what they really lost a lot of? Reputation, right? They were bad actors. They were bad people. And the ROI on your reputation is huge, especially in healthcare. If you get a reputation of being a bad place, of being someone who defrauds the system, guess what? The OIG and the DOJ will put your name on the front page of every one of their websites without even thinking twice about it. If you pay them $100,000 or you pay them $100 million, they're going to say, you did this wrong. What patient is going to want to go to a provider who has been in the papers, who's been on the internet, who's been whatever, right? And everybody should be researching that. So when you think about ROIs from a standpoint of should I invest in this company? Do I really want a steady partner? What should my compliance executive be doing for the yield on their compliance program? If they're doing it right as a compliance executive, the yield is tremendous. It is a selling point. It is a badge of honor. It is a white hat. People coming in, people look at you differently, and it really has a true ROI.
What could the CEO in that movie have done differently to make Stanley Tucci and Demi Moore's characters true partners? How can healthcare CEOs learn from this disconnect?
I think as a CEO and as the highest levels of the organization, it's really important that they give compliance executives and compliance people decision-making authority and not just sit there as an advisor when it comes down to it. The best leaders create kind of strategic planning sessions for their compliance executive because they want to sit down and listen to them and have a conversation. But again, a lot of CEOs and a lot of executives will listen to this and go, I know my compliance officer and I don't want to sit down and have that person. Then you got the wrong compliance officer. That's not your steady partner, right? And so if you sit there as a CEO and you think about it and you're like, hey, can I sit down and have a strategic discussion with my compliance executive? If the answer is yes, and I'm just not doing it because I don't want to know what they say, then you're doing it wrong. If the answer is no, I can't have that strategic discussion with this person because everything I say, they go running around and saying the sky is falling, then you have the wrong steady partner. They're not a steady partner. You have the wrong compliance executive. They're not a compliance executive. You have a compliance officer. And you need to upgrade into the next session. And every compliance person listening out there, you need to make sure you're that person for your CEO. And so you think about it when the standpoint of this movie that facilitating a high-level decision-making person within the organization like this investment bank who sat at the table, who had a discussion. Now, one part of the movie which was really interesting is there's this kind of whispering conversation between Demi Moore, who was the chief risk officer, and Kevin Spacey. I think he was a executive VP of trading. Kevin Spacey leans over to her and goes, I told you this was going to happen. You didn't listen to me. And she's kind of shaking it off. That is a leadership problem, right? So whether she felt like she couldn't listen to Stanley Tucci's position or Kevin Spacey's or go to the CEO or have a seat at the table or being able to be heard from that standpoint, the culture of the company created this problem where someone didn't feel comfortable enough to sit down, or she was just a piece of shit and did not want to communicate because she had other agendas. And at the end of the movie, she ends up getting fired because she's a scapegoat for everything. because she didn't know the information. She didn't communicate it to anybody. So one of those two things have happened, right? So the culture is a problem, or this person is bad and they're not communicating correctly. So as a CEO, sitting down and knowing who your people are, allowing them the ability to, be transparent, to document everything, to have a conversation, examine things, really be strategic and tell me what's going on. That's what you need to do for these people. They'll keep you out of trouble, I promise you. And they'll produce probably the best ROI within the company. It's probably the best unseen underground ROI that you would know.
Let's get practical. Healthcare CEOs who want to build this kind of partnership, what are the specific changes they should make in how they work with their compliance teams?
I think I talked about this a little bit in the last one too. First and foremost, find your steady partner. Interview for it, ask the right questions, test them. Here at our company, we test all of our compliance executives. They go through a pretty big test to be able to do that. And as a CEO, you should do the same thing. You don't just hire people on the resume. You don't just hire people because they said what they've done. You put them to the test. You have them analyze situations. And if they come out with a very hard approach that doesn't lead to adaptation or evaluation of issues, you know right off the bat that they're not the right people. If you can include them into your strategic planning, if you can have a conversation with them, if you can have a sit down executive discussion with them, then that's probably your right person. And having them report to you on a routine basis, in addition to not being concerned about them reporting to boards and board members, that's your indication that you got the right people. And that's how you put the right steady partner in place right off the bat. It's the first thing you should start with so you don't have these problems.
What's the key mindset change you want healthcare leaders to make?
First and foremost, I need to see compliance as a compass and not a cop. If you see that individual as someone to help guide you through the regulatory landscape, through all the do's and the don'ts in healthcare, the things that can get you in trouble, help navigate the situation, then that is the person who's going to help you out. If you're just going to hire a cop to run around and enforce and beat up, the compass got to do a little bit of that too. The compliance officer has to do a little bit of that too. But at the end of the day, you really want their main focus to be, how do I navigate through the situation? The margin call of Stanley Tucci's role would have been, hey, I'm a compass here. I'm going to help navigate through this, as opposed to getting terminated, fired, not sitting at the table, not having a strategic discussion. Things would have gone completely different. When we talk about being proactive versus reactive, you want someone to say, hey, this is how I prevent things from happening. This is how we stay ahead of it, versus going, hey, yeah, these are the things we shouldn't have done. Now we got to go fix it. And being proactive versus reactive is a huge piece.
When healthcare leaders do build compliance as a steady partner, what does that enable them to accomplish that they couldn't before?
If you don't have a steady partner, you're really just reacting to situations and trying to avoid disasters that are happening based upon what's happening today. I think that creating a steady partner will build a program that will scale with your systems. It will scale with your growth. And they can also be very innovative when it comes to how to do things in a regulatory environment. Not just having somebody who is responding to disasters, who's putting out fires, which is going to happen. You're going to have that too. But really build something that helps you grow, is scalable, and at the end of the day is going to really be that partner that you need to ensure that they can drive strategic confidence as opposed to just regulatory guidance.
Ross, this has been so helpful and so informative. Thank you for sitting down with me today.
Yeah, thanks, Cami. I love doing the individual podcasts, and the steady partner is really important to me because I feel like it's the backbone of a compliance program. And I think it really does make or break what a company can see in their compliance program, and the amount of trust and faith that a CEO puts in their compliance department begins with its leadership. So one of the most important aspects of a program, and I think can make or break what goes on in healthcare organizations. So really glad to be able to speak to it, and love all the steady partners we already have out there. Thank you for listening to today's episode of the Compliance Advantage podcast. If you enjoyed it, please rate, review, and share this episode with someone who might benefit from it. Don't forget to visit us at ronanhc.com for more resources and connect with us on social media for the latest updates. And remember, compliance pays dividends. Invest today.